A warm welcome, my dear students, in our health class. To formally start our discussion, first, let us identify the following. Content standard. Performance standard. And most essential learning competencies. To jumpstart, let us recall the definition of health. It is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. It is most often being related to solely the physical well-being of an individual. It is not more than looking healthy, but an individual must also be feeling, thinking, and interacting healthy to achieve wellness. Well, disease is a particular abnormal condition that negatively affects the structure or function of all or part of an organism, and that is not due to any immediate external injury. Diseases are often known to be medical conditions that are associated with specific signs and symptoms. The topic for 4th quarter Health 7 is about non-communicable diseases. For the review, let us recall the factors that develop non-communicable diseases. You only have 20 seconds to think about it. Ready? For the answers, factors that develop non-communicable diseases are climate, hereditary, lifestyle, and drugs. Our first topic for today is all about how to prevent and control non-communicable diseases. Asthma, allergy, arthritis, cancer, cardiovascular disease, diabetes, and renal failure are some examples of non-communicable diseases. Here are the different kinds of allergies. The substances that trigger allergies are called allergen. Allergens could be coming from certain foods, dust mites, pollens, molds, and danders. Most minor allergy symptoms can be treated with antihistamines, corticosteroid, or decongestant. Immunotherapy is a long-term treatment option for chronic allergy symptoms. Moving forward are the most common cancers. On the first column, you're gonna see where it occurs, like from the skin, colon and rectum, lungs, breast, reproductive organ, bone marrow like leukemia and lymphoma. On the second column, you're gonna see how common it is. And then on the third column, you're gonna see how curable it is. For the warning signs of cancers, we have the cautioned up. It means change in bowels, a sore that does not heal, unusual bleeding or discharge, thickening or lump in breast or elsewhere, indigestion or difficulty in swallowing, obvious change in wart or mole, nagging cough or hoarseness, unexplained weight loss, and persistent hoarseness. Surgery, radiation therapy or radiotherapy, drug treatment or chemotherapy are some treatment for cancer. Next is the cardiovascular disease. A serious stroke can cause death. A person with both first-degree relative or parent or siblings and a second-degree relative like uncle or grandparent who suffer from heart disease before the age of 60 is nearly 10 times more likely to suffer from heart disease early in time. Negative emotions and depressions are risk factors for heart attack and stroke. Conversely, happier people are less likely to develop heart disease. The next part are the two types of diabetes. Type 1 is the result of little or no insulin produced by the pancreas, and type 2 result of too little insulin production by the pancreas or failure of the insulin to function normally. When we say insulin, it is the hormone produced in the pancreas that regulates the level of glucose in the blood. Warning signs and symptoms of diabetes: urination, thirst, and hunger. The next lesson is all about the programs and policies for non-communicable diseases. Here are some win-win approach for non-communicable diseases prevention: education, agriculture, industries, and urban planning. Education: improve scholastic outcome and less risk factors. Agriculture: improve production of fruits and vegetables. Improve consumption of fruits and vegetables in population. Industries: it improve productivity, less expenses on sickness of employees, and prevention and control of NCDs in workers. Urban planning: beautiful city, more tourists, more money. More physical activities, tobacco control. Non-communicable disease prevention and control strategies. We have the target and the effect. For health promotion, primary prevention, secondary prevention, and tertiary prevention. For the health promotion, the target are the entire population, and for the effect, it prevents risk factor, lower population risk. Primary prevention, target people with one or more risk factors. Effect, prevent the development of disease at early age. Secondary prevention, target people at early stage of disease. Effect, prevent disease progression or recurrence. Tertiary prevention, target people with symptomatic or advanced disease. Effect, reduce complication or disability. Another topic is all about the agencies responsible for non-communicable diseases. First and foremost is the Department of Health. It is the primary government agency responsible for the equitable, sustainable, and quality health for the Filipinos. The DOH implements such programs to prevent and control non-communicable diseases in the community. Here are some of the Department of Health programs to prevent and control the non-communicable diseases. The Department of Health conducts separate and distinct health promotion campaigns at the national, regional, and local levels. Here are some of the Department of Health campaigns to prevent and control non-communicable diseases. Aside from that, here are the Department of Health Max campaign to remember. No smoking. Do not drink alcohol. No to illegal drugs. Manage your stress. Do physical activity. Eat low-fat, low-salt, and high-fiber food. Prevent hypertension and diabetes. Here are the actual poster of Department of Health for their MAX campaign. Health centers. This is designed to give medical services nationwide. And these are the following health services provided by the health center: medical services, dental services, nutrition services, research and laboratory center, health education and manpower services, family planning and natal care services, Center for Cancer Control. And these are other organizations that may help to prevent and control non-communicable diseases. We have the non-government organization, the local government units, and the Department of Education. They regularly conduct activities to promote school health and nutrition and the control and prevention of non-communicable diseases. And these are the following: lastly are the various Department of Health, medical centers, and specialty hospitals. For the next slides, you're gonna see the different pictures and the location of each medical centers and specialty hospitals. San Lazaro Hospital is considered as the oldest hospital in the Philippines, located in Quiricada Street, Santa Cruz, Manila. Philippine Heart Center located in Diliman, Quezon City. National Children's Hospital located in E. Rodriguez, Senior Avenue, New Manila, Quezon City. National Kidney and Transplant Institute located in East Avenue, Diliman, Quezon City. Lung Center of the Philippines located in Quezon Avenue, Diliman, Quezon City. And Philippine Orthopedic Center located in Maria Clara Street, Santa Mesa Heights, Quezon City. For the activity entitled Health Brochure, you're going to make a creative brochure that informs the public about non-communicable diseases. You will choose one example of non-communicable disease. In your brochure, you will write the following about your chosen NCDs: short description, causes and effects, signs and symptoms, prevention and control of NCDs. That is the end of my presentation. I hope you learned something about non-communicable diseases. Here are the references that I've used in doing my video lesson. Photos used here are from Canva. This has been your teacher for today, Mrs. Cynthia Soledad S. Aspe. Thank you for watching! Before I end, I would like to share something to ponder from Henry D. Bracton. An ounce of prevention is a worth pound of cure. Keep safe, grade 7!